welcome to Spear Medical Education and another episode of Explaining. I'm Eric, and today we're going to be looking at what meningitis is. So, this is aimed to be a brief introduction to what meningitis is, explained in a nice straightforward way for those that are unfamiliar with the topic. So we start first of all with our poorly drawn brain, because this is actually where meningitis becomes an issue. This is where the infection settles in and causes us all the problems that we get with meningitis. So if we zoom in on the brain itself, we can see it's actually surrounded by three layers, a three-layer membrane, and that's known as the pia mater, the arachnoid matter, and the dura mater, as annotated by by the coloured sort of layers and lettering. And together, these are known as the meninges. So it's no accident that meningitis is called meningitis. It means it's concerned with an infection of these meninges. So how does that actually happen? So if we sort of go down here to some more poorly drawn images from me, what you can see here is we have our infection, whether that's viral or bacterial, and somehow it's got into the body. So that's not necessarily a direct infection of the brain. What we normally see is meningitis as an indirect consequence of an infection somewhere else. So this could be an infection through a cut, or it might be a sort of throat infection, a bit of a sore throat, or a chest infection, for example. And what happens is, regardless of how the infection's got into the body, there is the small chance that the infection can actually spread up to the brain, because it's in our blood, it's travelling around the body. Now, normally, when the infection gets up to the brain, it's protected by, the brain's protected by something called the blood-brain barrier. And what this does is filters filters what goes in and out of the brain. And normally, in a sort of normal day, this blood-brain barrier would stop any viral or bacterial infection crossing over into the brain and causing us all those problems. Now, with meningitis, for whatever reason, one of these bacteria has managed to slip the net, get around the fence, if you like, and start getting into those three linings of the brain, the meninges. So what we get from there is a poorly brain. So the brain becomes infected, or the meninges become infected, and what the body does to try and deal with that is cause inflammation. So it causes swelling of these meninges to make them less permeable and to try and stop things getting through and more infection getting through and causing more problems. This inflammation also enables the immune response to occur and the body to start fighting the infection. So we start to see this swelling of the meninges, which can actually raise something called intracranial pressure, so increase the pressure within the brain, or in the skull, which will start affecting the brain and the way it normally functions. The peripheral nervous system can also be attacked, as can the spinal cord. So we can start to see damage of the peripheral nervous system and the spinal cord as the fluid that they're all held within, the cerebrospinal fluid, starts to also become infected. And as I say, a side effect of all of this is this raise in intracranial pressure. So all told, this causes a lot of problems, obviously, for the patient. We start to see massive dysfunction of the nervous system, both peripheral and central, and that's where we start to see some of the strange signs and symptoms associated with meningitis. These signs and symptoms include high fever, fatigue, restlessness, agitation, chills, and then actually, the reason I've made those blue is that they are the same signs and symptoms you'd expect with any infection, really, any sort of cold flu-like infection. When we start to think meningitis, are these more red symptoms, so unexplained seizures, light sensitivity, so unable to tolerate looking at the light or being in a light room. And I know from my own patients, even the small blinking light on my radio in a completely pitch black room has been enough to cause incredible pain. So we're talking extreme light sensitivity here. We've also got that stiff neck, that inability to sort of touch your chest with your chin, or extreme pain on doing so. They can also be very sensitive to sound. We can expect any level of abnormal neurology, so any weakness or odd sensations in any limbs, for example. And then I've put down here in stars this non-blanching rash. And the reason I've put it in stars is actually we kind of get fixated on this with meningitis as being the definitive symptom. Either is or is not meningitis via this rash. And actually what we see in practice is this is one of the last symptoms that you see. So all of these other symptoms that we've just talked through, you're going to see all of these in your patient first of all, and the patient's going to look really, really, really unwell. Then, towards the sort of terminal decline of the illness, towards a point where their life is seriously at risk, we then start to see this non-blanching rash appearing. So what we mean by non-blanching is if you was to get a glass tumbler and roll it over the rash, it doesn't disappear. And that's because it's actually not a rash per se. It's not an irritation of the skin or an abnormality of the skin. It's actually the blood vessels that obviously carry blood all around the body. So if this is a cross-section of one of those blood vessels, as you get more and more poorly with meningitis and a few other things, they start to become leaky. So they dilate, they get bigger, they widen, and on a cellular level, they dilate. And what we get from that is actually the blood starts to leak out of the blood vessels and into the surrounding tissue. Once it enters the surrounding tissue, we start to see that sort of traditional purple non-blanching rash. So actually, relying on just seeing that rash as a symptom of meningitis is quite dangerous, because if we're leaving our suspicion of it being meningitis to the point of seeing this rash, it's already too late for the patient. The patient's already in their terminal decline at that stage. So we need to have a high suspicion of meningitis when we start to see some or all of these symptoms first, and then the non-blanching rash sort of just confirms it. I know in my own practice, if I suspect meningitis, I'll administer a broad-spectrum antibiotic, and I won't sit and wait for this rash to appear first. So, what do we do about it then? I've sort of just kind of touched on it, I guess, but if you're not medically trained, so if you're just watching this video out of interest, then obviously you're going to call for the emergency services. You're going to call your 911, your 999, your 112, or sort of whatever the system is for your country. For pre-hospital care providers, it all depends on the level of your training and the scope of practice that you're currently working under. But these two things are pertinent to anybody. So if you're a sort of basic life support provider, if you're a low acuity tier crew, then actually, regardless of this other stuff that I'm going to talk about, rapid transfer to the emergency department and anticipating sudden deterioration is applicable to all of us. But if you are working in a paramedic or physician-led system, then we'd be looking at things like administering broad-spectrum antibiotics, oxygen if indicated, which most of the time it will be for these patients when they're severely ill, and then fluids again if it's indicated. Other things that we could look at are things like antiemetics, so anti-sickness drugs, to combat some of the symptoms that they're feeling, and also we can also just try and manage the environment a little bit. So if they're burning up, obviously start just sort of getting those layers of clothes off, getting the blankets off, and all that sort of stuff that people tend to wrap themselves in. So like I said, treatment is going to vary on your skill level and grade really, but if you're a pre-hospital care provider, the right answer for these patients is always rapid transport to definitive care as being the most important thing, because there's a lot of things that need to happen in hospital. So, hope you found that helpful. If you did, give us a like and a subscribe, and look forward to more content from us. Thank you very much.